morning, Miss Erica.
Identify the client and explain the procedure. This is to prevent errors and enhancing client to be cooperative and fund his confidence. Assess client health history, which includes personal, family, social, previous obstetrical, and present obstetrical data. This is the information gathered by healthcare provider will establish baseline data, identify teaching needs. Assess the client's knowledge and guidelines for health pregnant and antepartal care. This is to provide baseline data to identify teaching needs. Review the plans for antepartal care visits, examination, and laboratory findings for succeeding prenatal care. Monitor vital signs of the client. Provide a baseline data or future comparison and identification of factors that may place the client at risk for problems. Measure the height on initial visit and monitor the weight in succeeding visit of each prenatal examination. A gain or decrease in weight will affect pregnancy. Conduct physical examination. Begin assessing from the head to toe to come with a general impression of woman's health and well-being. Instruct the client to empty or void her bladder to promote comfort on the part of the patient. Position the client in dorsal recumbent. Proper positioning relax both mother and the baby. Drape client and expose the abdomen from level of the xiphoid process down to the symphysis pubis. This is to provide privacy. Measure the fundic height using tape measure starting at 0 cm. The centimeter side of the tape measure must facing the abdomen while the inch side is facing the examiner. This is to prevent bias. Locate the highest point of the fundus. Leave one hand in place and secure the end of the tape measure to the fundus. Document the measurement in centimeter to compare the calculated gestation. Good morning, ma'am. I am Ciara. I am a student nurse. May I know your name, ma'am? Mrs. Erica, I will be performing Leopold's maneuver. This is to determine the direction or the position of your baby. Would you like to go to the bathroom first before we can start the procedure? First maneuver, Fundal grip. With both hands, palpate upper abdomen and fundus for consistency and mobility. This is to determine the fetal part lying in the fundus. Second maneuver, umbilical grip. With both hands moving down, palpate the sides of the uterus from the top to bottom. One side, smooth, heart-resistant surface. Other side, angular modulations, knees and elbows. This is to determine the fetal back for fetal heart zone, usually found at the left lower quadrant. Third maneuver, Pollex grip. With the right hand over the symphysis, identify the presenting part by grasping the lower abdomen with thumb and fingers. This is to determine engagement of the presenting part. Fourth maneuver, pelvic grip. The nurse alters position by turning towards the patient feet. With both hands, assess the descent of the presenting part by locating the cephalic prominence of brow. Place your fingers on both sides of the uterus about 2 inches above the ingletual ligament. Press downward and inwards. If the fetal back is palpated, it meets no obstruction. This is to determine the degree of flexion of the fetal head. Reposition the client. to make the client feel comfortable.